Hello viewers, welcome to this week's episode of Health Watch on Anglican Cable Network Nigeria. I am Angela Mwenze. The recent alarm on rising global incidence of cancer by the World Health Organization should worry African countries, including Nigeria, where the disease is most prevalent. Available statistics show that cancer killed 7.6 million persons in 2008 worldwide, and there is indication that the figure could double to 13 million by 2030. According to WHO, cancer accounts for 13% of all deaths registered globally, and 70% of that figure occurs in middle and low-income countries. In Nigeria, about 10,000 cancer deaths are recorded annually, while 250,000 new cases are recorded yearly. It is also worrisome that only 17% of African countries are said to have sufficiently funded cancer control programs, while less than half of all countries in the world have functional plans to prevent the disease and provide treatment and care to patients. WHO also indicates that the shortage of functional cancer control plans is especially alarming in developing countries, which already accounts for more than 2/3 of the new cancer cases and deaths each year. The question that worries the mind is, what is cancer? What causes it? Is it preventable? This and more we shall be discussing on today's episode. And my guest is Dr. Las Ude Eze. He's the Executive Director of Pink Oak Cancer Trust, and of course is a medical doctor. You're welcome to the program, Dr.
Thank you,
Las.
Angela.
Good to have you.
Here.
Good to have you on the program today.
Right.
So we are discussing cancer, and we really want to educate everybody watching on what cancer is. I think that's the first question. I would like everyone to know, what is cancer in the simplest term?
Well, in simplest terms, let me try to describe from the normal to the abnormal.
Abnormal, okay.
The body is made up of cells. They are the building blocks of the body. So every part of the body has its cells that come together to make it up. So when these normal cells, by any situation, they divide. Of course, yeah. So if you do biology, the cells divide and they keep multiplying. So some die off, new ones come up.
So just like the skin, how you have the skin, to get the new skin, you get new cells.
Absolutely.
Yes, okay.
Even though some parts of the body have the cells divide more than others. Okay. So if you have any situation where that control, because the cells, depending on the part of the body, has internal control to know when to divide and when to stop. So if you have any situation where the cells now begin to divide, without stop, of course, it's, without control, it gives, and the functions of the cells also get distorted. Okay. So it can lead to what we don't expect. Just trying to break it down without
using any medical. Just for example, jargons. Let me see if I can roll it round. So you have the skin, maybe a part of your body is dividing. Something always tells it it's enough, stop at this point. But now, in this case, that thing is not telling it to stop. So it just keeps. Stop.
Yes, and the normal, functions of that cell, there's also alteration. Okay. In that it's not just that, okay, it's dividing and getting bigger, but also is sending out, misbehaving, in short. Okay. So cancer affects every part of the body except the hair, H-A-I-R, not the head.
So that's why I've never had hair cancer. Okay.
Except the hair and the nails, the fingernails, whether finger or toe. Okay. The nails, those are the only part of the body that you don't. So any other part of the body could have cancer. Okay. And anybody from children to adults could have cancer.
From children? I thought it used to
there's childhood cancer.
Okay.
There's childhood cancer. You have neuroblastoma. Okay. That's largely affect retinoblastoma, affecting the eyes, the retina. You have nephroblastoma. That's mostly the kidney. You have Hodgkin's lymphoma. You have Burkitt's lymphoma.
That's from childhood.
Yes, those are common childhood forms of cancer. You have leukemia.
Yeah, leukemia.
The AML, acute myeloid leukemia, the chronic myeloid leukemia, and all that, you know, so there are more among children.
Oh.
Then you also have cancers that are, majority are commoner on the other extreme of age among
the older
elderly
you
people.
get. Okay.
You know, so but you also have the ones that tend to occur more often middle-aged persons. For instance, breast cancer. You know, usually women in their 30s, 40s. It also occurs in men.
Breast cancer in men?
Yes, you have breast cancer in men.
Okay, I was tempted to ask you, how does it happen? I mean,
you know,
okay, just a normal lump and...
Yes, because men have breasts too, just that one is bigger than the other.
Okay.
Yes, so, and that's why it's more common in women, because they have more tissues
around there
that could be affected. So, but for men, you know, most times breast cancer in men is not even detected early, because one, a man will not be conscious, and if you find something there, you may think maybe it's pimple or it's just, you know, you may not give it much attention. But a lot of times it begins with abnormal discharge from the nipples. You know, you may also find lump, but you know what you have at the man's chest is mostly muscles and all that. You know, so there will be lump there which might not be detected on time. So, but we begin to see abnormal discharge. You know, is a sign to go. It doesn't mean that every abnormal discharge in a man is cancer. So, but that's a sign that might trigger you to go and check what it is, because it's not normal at all.
The campaign against for breast cancer in women, should not. Breast cancer shouldn't just go for women.
Yes.
Men should also.
Yes, I've
listen
seen 5
to
men with breast cancer.
Wow.
And I know a survivor, a man who survived it for 10 years now.
Wow.
He's been without it. And all his treatment was done here in Nigeria.
Oh, great.
Yes, so we are not talking about,
going to
foreign people. The man is in Nigeria, his treatment was done. His treatment was done here.
Oh.
You know, so various forms of cancer, it affects every part of the body. So when we begin to talk about the prevention or the treatment and all that, is specific to the type of cancer.
Okay.
How you prevent cervical cancer, which affects a part of the womb, is not how you prevent prostate cancer, which also affect the male sexual organ, the prostate. So, and there are some that the cause. Yeah, there are many that you don't know the cause.
Yeah, and that was going to lead me to my question. You see, this thing is rising. I mean, the prediction is you're looking at over 13 million by 2030. What would have been responsible for this rise? Is it that cancer was there before and we didn't know? Or is it that it's a new thing? Or are we doing something wrong? That I don't know. What exactly?
Well, it's a combination of a lot of factors. It could be that perhaps, let me say for the sake of Nigeria, 10 years ago, we don't have as many diagnostic equipment in the country as we do now. So it could be that our capacity to diagnose is improving. Because if you don't diagnose it, you will not know it's there. And you hear about these health conditions that you say, oh, this person is ill, he or she was very fine but started having these symptoms. They went to the hospital, they did every test they could, and they said they didn't find anything. So people will not say, maybe it's spiritual attack, maybe, and they start,
going diabolical and going to medical help.
It could just be that it's cancer, or it could be any other health condition that the hospital he or she went to does not have the equipment or the people with the expertise to diagnose it. So they can only say what they know. So the rising cases could be that our capacity to diagnose it is improving. We are not yet there. We are under, the equipment and expertise is very low. So, but there's been some improvement. It could also be changes in lifestyle. Right now, before maybe like in 20 years ago, fast food and all those things are not quite common. Now the world is a global village. We see a lot of things on the internet, some kind of food that are not very common here. And people are beginning to prepare it here. People are getting busier, from work, they drink. Yeah, and they don't exercise or do anything. They take soft drinks, they take snacks, they are sitting down from morning till evening, no more physical exercise. you know, not so that's also the nutritional aspect.
The nutritional aspect, yeah, the lifestyle that is changing.
Right.
Because I know there's been lots of studies that have been showing there's a bit of correlation with the way our lifestyle has changed over the years and what we are getting now. Anyway, that's very interesting to know that, of course, we need to start to watch our lifestyle to get that in order. So, just as we discussed earlier, at what age? Well, okay, we talked about but young people can get the cancer.
Even congenital, you have cancer that someone is born, a baby is born, and
the person has the cancer.
Yeah, it's not so common, but it happens.
Okay, now cancer itself, is that what is the problem? Well, it starts with the tumor, and in most cases, I want to believe it has to do with the tumor. But is it always because of that tumor, or what is actually the problem? I don't know if you get my what's actually the problem. Why are we?
It begins from the cell.
Okay.
The cell of the organ that is affected. Let's take cervical cancer, for example. Good enough, we know the cause of cervical cancer.
That's a human papillomavirus.
Yes, the human papillomavirus. We know the cause of liver cancer, hepatitis B virus. You know, so those ones, you know, like this organism could get in here. The organism may not cause any harm. It's just there, no symptom, nothing. But it's just in there, the virus interacting with the tissue, you know, passing out some things that the body don't quite need, and over time causing some changes within the cells of that tissue. You know, so for those that go for pap smear, you know, to look at the place for any woman that is sexually active, because human papillomavirus is sexually transmitted. For you know, when it's sexually transmitted, it can also cause anal cancer, but you know that one is not as common as the cause of cervical cancer. You know, so it begins to cause those changes. How we can prevent it is also known. Vaccination.
Yes, I know there's recent vaccination going on, and every young child below 12 must have the. Is it any young girl? I think.
Young girl, we're around, you know, 13 to 15 or 12 or thereabout. You know, so 9 to 12, some say 9 to 15. So the idea is you get them before they become sexually active. If they're sexually active, the chances that they've been exposed to the virus is there. You know, so that's one part is preventable, we know the organism. And even if you miss out in terms of preventing, for those who are sexually active, you periodically go for pap smear. You know, so there's also one they call visual inspection using acetic acid, where you don't have people with the capacity to do pap smear, because pap smear requires some equipment and technical expertise to do. So if you're observing some changes, you know, even
in the cell and the lining,
all that, you know, you'll be able to suspect that maybe something is going on. And if you take a sample to the lab, it could show that okay, these changes are consistent with they call cancer in situ. Then cancer hasn't started, but
you know that something unusual. Okay, we just
be tackled from there.
From there, okay. We're still going to be talking on how to prevent it, but we'll go on a quick break. When we return, we'll continue discussion on how to prevent cancer. That's very important. All right, viewers, we'll be right back.
If you or someone you love has cancer, the fear and confusion that follows can be overwhelming. Understanding the basics of the disease can help.
This year in the United States, 1.4 million people will be diagnosed with cancer, a group of diseases characterized by abnormal cell growth in the body. To understand the effect of these abnormal cells, it helps to look first at how healthy cells function. Each of us is made up of millions of cells, the building blocks of the body. Cells make up tissue, and tissue comprises organs. Healthy cells grow in a controlled way, living for a period and then dying naturally. When a cell dies, the body replaces it with another. A set of instructions are located in the body's DNA that tell each cell how to complete this life process. Sometimes, however, mutations occur in parts of a cell's DNA. The result can be the formation of harmful, cancerous cells which grow in an uncontrolled manner. This initial mutation can occur from within the body, for example, as a hereditary trait, or as the result of an invading virus. Or the mutation can be the result of external factors, such as chemicals, tobacco, or radiation from the sun. Whatever the cause of DNA mutation, once it occurs, cancerous cells often begin to grow and divide at a very rapid rate. This can lead to a built-up mass of cells known as a tumor. Sometimes a tumor will be benign, meaning that it remains self-contained. Other tumors are malignant or cancerous and actually attract their own blood supply. This means that the body unwittingly provides the nutrients and oxygen that a tumor needs to grow. Cancer becomes more serious when cells break away from a malignant tumor and metastasize or spread through the bloodstream or lymphatic system to either adjacent or distant organs. The lymphatic system is one of the body's first defenses against disease. It includes the bone marrow, spleen, thymus, lymph nodes, and lymphatic vessels, which are tubes that carry infection-fighting white blood cells. Some severe cancers, like lymphoma, actually form in the lymphatic system and therefore do not manifest as tumors. Regardless of the type of cancer, if malignant cells are carried to vital organs in the body and settle there, the result can be death. Although cancer can spread, its classification is based on the area where the malignant cells originated. For example, breast cancer, one of the most common forms in women, begins with mutations in the breast. Similarly, the most common form in men, prostate cancer, originates in that gland. No matter the type of cancer, however, its diagnosis is not necessarily a death sentence. Today, early detection and advanced treatment methods make the prognosis for people with cancer better than ever before. Cancer can be curable, but it is still the second leading cause of death in the United States. If you are concerned about this disease, make an appointment with your doctor to discuss screening.
Welcome back. Before we went on the break, we were discussing cancer, and my guest is still Dr. Lars Ude-Eze. Thank you very much. So before we went, we were discussing how to prevent cancer, and we talked about the cervical cancer that is caused by human papilloma virus, which is clear. So we stay away from sexual intercourse. Well, yeah, that
for those who can,
yes,
right.
And those who are sexually active should go for constant human pap smear test. You know, so that's for
HPV, cervical cancer, liver cancer, hepatitis B virus, which is also vaccine preventable, and that one they give to children. So HBV is part of the immunization they should get at birth. You know, so you have HBV 0.
But that is that's been recent. You know, it's a recent.
It's part of the routine immunization that is given at birth. They give polio, they give BCG for for TB and all that. So there's a whole routine of vaccines that should be received, and a child at 9 months should have completed immunization. So it's not every vaccine that is free, but government prioritize the ones that that is very much common and the one they could also afford. So if you take all those free government vaccines, that includes pentavalent vaccine, which has 5 in 1. It has for diphtheria, pertussis, and others. Let me not go into much into a vaccination, but the important message here is that hepatitis B can be prevented by vaccines and is given at birth, free. Government takes care of that.
So hepatitis B virus will be the one that is responsible for liver cancer.
Because when it gets in, it to first of all cause hepatitis.
Okay.
So after a very long time, it causes some changes in the liver that can lead to primary liver cell carcinoma. Okay. So, which is liver cancer. Okay. So it's not just if you get the virus today, tomorrow it's cancer. It takes a long while. The same way HPV, human papillomavirus, takes a while. Okay. You know, so for adults, you can do hepatitis B screening, and if it's positive, they will tell you what to do. So these ones are clear. But you know, there are cancers that you can't really say, oh, this is the cause of the cancer. And, you know, tobacco smoking is implicated in over 1/3 of the entire cancer the body can have. You know, so for those that smoke, they have higher risk of having cancer, especially lung cancer. It doesn't mean that everybody that smoke will have lung cancer. It doesn't mean that everybody that have lung cancer smoked. I know, someone, at least a couple of persons who had lung cancer that never smoked. But it's not just when you're the one smoking, there's also passive smoking, when someone else is smoking and you're there. But there could be other factors, but it's the most significant risk factor for lung cancer and so many other cancer in the body. Okay. So tobacco, smoking, so avoiding it. Avoid that, okay. Yes. Right. General healthy lifestyle, good nutrition, predominantly natural things, preservatives and all that. You may never know the chemicals used and what it could cause in the system. So as much as possible, eating things fresh, balanced diet, and also exercise, you know, helps generally for the well-being of the body. You know, if you go to, say, breast cancer, now some specifics, risk factor. Risk factor is not the same exactly as cause. Okay. So what risk factor is, let me try to explain, is like, okay, if you get a population of, say, 100 persons that have had, say, cancer of the bone, and you do a study among those 100 persons to try to establish what could have been responsible. There are some factors you may find in them that maybe more than 70% of them do this. You know, so it could be, and if it's after some research and analysis is significant, you will be able to say, okay, maybe there's something about this that could be responsible. You know, so you may not be able to say, okay, this caused this way. So for most cancers, those are how those risk factors came about from studies. I'm glad you're even explaining that, because you see people who look at, you know, for example, they just say it, the cause of cancer is smoking. You know, they'll just say if you smoke, you must get lung cancer. But they think that's the cause, and they don't realize there's a difference between what. Like you can say for sure, human papillomavirus is the cause of that, which means without human papillomavirus, you will not have that. But you can't say same for the risk factors. You know, so most of the times for those cancer, you can't really say, okay, this is the cause. It's by regular body check, screening. That's why screening is highly encouraged. It's a form of prevention, because when you screen and you identify it very early, it's curable, it's treatable. Okay. So in prevention, you have primary prevention, secondary prevention, tertiary prevention. Okay, so what we have talked about now is the primary prevention. Primary prevention is like in the case of HPV, HBV, that you ensure that the virus does not even get there in the first place. Okay. That's primary. You know, so when you screen for the ones that you don't have absolute control, and you find it is already there, that's like secondary prevention, because the cancer, you've already found it there earlier, but you want to prevent it from getting severe or spreading to elsewhere. So that's secondary prevention. You found it there, but prevent it from getting worse, getting complicated, and killing the person. And all of them are important. There are some cancer that affect, you know, organs that are hidden, that most times, like pancreatic cancer. Pancreatic cancer, when it starts, it be giving symptoms mimicking ulcer and some other abdominal health conditions. So a lot of times, before you even get to know it's pancreatic cancer, it has already spread and leads. So what should people be doing? Because it's so common now, because I think I've heard people with cancer so much in the past couple of weeks, you know, you just keep hearing people, oh, this person died of cancer, this person died of cancer. And you're wondering, what should people be doing? Do you just keep going every time, go and check, let me be sure that nothing has gone wrong? The thing is, for every woman, self-breast examination is important. Okay, for breast cancer. You know, for breast cancer, if you find any lump in the breast, find out what it is. Not every lump is breast cancer. So it's not if you find lump, you start panicking. But at the same time, you cannot know whether it's cancer or not without taking it out or taking a sample from it, and the experts check it. Okay. So that's to the best.
So for breast cancer, the thing is, do the check.
Self-breast examination. You could do mammogram. Mammogram is a form of imaging, radio imaging, that if there is a lump there, you can pick it up.
Yeah, to pick it. Okay.
Those that have the money can do mammogram. Just is also a form of screening. Okay. The simplest one everybody can do is, and there's a technique to it. You kind of see the breast as 4 quadrants. Yes. You stabilize one part and
you go
around the thing. And some people, maybe when they are having their bath, that they just notice something, and it's not a time to say it's not my portion, I reject it. Because the thing is, it's not devil that gave us the idea to know about these things. So devil wouldn't have given us the idea to find solutions to the health problems. Yes, so it does not go against your faith when you identify something and you want to take advantage of medical knowledge that God has given to man. Because he said he created us in his own image. So, which means we have some level of power of creation. And that's why man has created an aeroplane and people are flying and created so many things. The TV we are watching, we're a creation of man based on the knowledge and the power God has given to him. Same in medical science. And there's a level it gets that is beyond human control. So that's why we don't know all causes of cancer. Yes. We can only get to the level that our capacity as human being has reached. Let's exhaust that level. When we reach that level and we it's beyond, we can now, okay, God, we've done all we can. So as you keep praying, as you keep interceding, talking to your God, you still explore, the knowledge that, what God has already provided for us.
And God also gives doctors wisdom. You could just be looking at it and know what to do. Some kind of test to run or what to do.
Yes, even though in humans sometimes you still make mistakes. Sometimes people go and they are misdiagnosed, which is a major issue in this part of the world. Misdiagnosis,
That's another one. Patients, you know your body. You know something has gone wrong, and then you go and the physician or whoever says, "Oh, everything is okay, I can't see anything." What's the right thing to do? Is to keep pressing, or what's the right thing to do for a patient?
Well, the thing is, sometimes you get second opinion.
Okay.
If you feel you are not satisfied with the diagnosis, you could go to another facility. Okay. Present and get opinion of the person that is there. Sometimes people go because doctors are not at the same level of technical competence. You have those who are specialists in a particular area. You have those who are general, but we are trained in such a way that you reach your peak, and if it's something you can't handle, you refer to someone else. But there are also some health conditions that we call psychosomatic disorders. Okay. Someone psychologically is feeling something, he feels is there, either based on previous experience or exposure. Okay. But in reality, it's not there.
Too much information sometimes.
Yes, anxiety and all that, but in reality, it's not there. So for those on, you just try and remove your mind from it, and let's see if you still have those. And inside of them, they are feeling those symptoms. But there are also some that are really feeling it, and really something might be there, but just that the person there may not have the capacity. And some, a few of our colleagues, may not be humble enough to know that, yes, that doesn't mean that you could find everything. Yeah. So they start, I tell you that it's this, take it like that, or, that kind of stuff.
Okay. So, I was just thinking, how you have, when you talk of AIDS, this HIV AIDS, it has, that it's not the virus itself that kills you, but other your immunity goes down and you get predisposed to other. Is that the same way it kind of operates in the case of cancer? I'm talking about, because we have a lot of people dying of this. We'll talk about the funding where we'll look at, issues that come from that area. But is that the same way it works when it comes to cancer, or
Cancer is a monster, and the way it operates, yes, it affects immunity, but not the same way that HIV does, because the HIV specifically fights the immune cells, so it knocks them down. It attacks the immune cells, and that's basically what it does. So HIV, the virus does not attack the body cells or any other thing. They just knock off, so it's like Aso Rock. What makes it what it is because of the security and the military presence there. So if you remove those soldiers and DSS and all of them, anybody can stroll in and go and hit the president and walk away, and nothing will happen. So that's what HIV does, that when it knocks those things down, diarrhea that will come and the body will fight it. Malaria that will come, anyone that comes will sit permanently and the body cannot resist it, and it will just overwhelms the body, and that's what happens. But in the case of cancer, it begins to destroy the tissue, and from there it spreads to through the blood to other parts. Breast cancer, first of all, it comes to the armpit. It may even, if you start from this breast, it might come to the other breast, or it may go to the armpit that is closest to from there to the chest, to the liver, to the spine, to the brain, So it keeps moving that way. Prostate cancer, the same. From here, it now goes to the spine, and from there, it could get to the brain.
So sometimes it's not located. It doesn't just mean, because sometimes people, I know someone has asked me before, isn't it just that there's a cell growing? What has the cell, getting bigger got to do with the body, with the rest of the body?
It alters the function of that organ, because, for instance, the liver does so much functions. So from the enzymes and detoxification, you take drugs, the liver help, it gets processed there. The one the body doesn't need goes through the kidney, goes out through the urine, and it does a whole lot of work. So if the liver has cancer, it will no longer be able to perform its functions. So because it's not able to perform its functions, then the body cannot survive without the liver. So it affects and the one that begins from the breast. From the breast, it starts, because here is just outside tissue. It gets bigger. Sometimes you get ulcer, it's smelly and all that. But if it only stops there, you may just take out the breast and the person could just be without breast, and everything ends there. But because it will start from here and spread elsewhere, if it gets to the lungs, it's no longer the problem of the breast. The lungs, the cells are already there now, and it will begin to affect the functions of the lungs. So you start having pleural effusion, which is water where you are supposed to have air. You start having fluid there. And the oxygen and everything that happened, the lungs functions will depreciate. And if the air that is coming in is not providing enough oxygen for the body to make use of, it causes another problem. And because if it's doing that, it will make the heart to start overworking itself. And if that continues, the heart will start failing. And it doesn't just stop in the lungs. Some cells will go to the liver and say, we are here. So those are the things with cancer. But if you pick it early and before it starts moving from one place to the other, you take it out, pump some drugs and maybe radiations because if one cell remains, that one cell will start dividing and still spread again. So the goal of the treatment is at the point you get it, if it's early. But if it has already spread, the aim of treatment is just usually palliative. Just, you do some interventions that could hit the cells, and it can elongate the person's life, so at least medically speaking now, because God has the absolute power of life and death. So, but medically speaking, because the amount of treatment you give to kill those cancer cells, kill it here, kill it in the lungs, kill it in the liver, kill it in the spine, the amount of treatment you give may even take the person's life.
Yeah, the normal cells too can be affected.
Yes, it takes the person's life.
Wow.
So, but when it's early, we may do surgery and fire some of those medications and radiations, depending on the type of cancer it is. If liver cancer is found on time and it's just one part of the liver, if you take it out, it grows back. Liver, that have tendency. Okay. But it's not every organ of the body that does that. Okay.
We're just going to a quick break, and when we return, we'll talk about the funding, and the issues with funding. All right, viewers, we'll be right back.
Apoptosis is simply the process that normal healthy cells use to kill themselves when things are going wrong within the cell. It's called programmed cell death, and within cancer cells, this no longer works or occurs the way it should, so the cells grow uncontrollably. The second factor affecting the way that cancer grows and spreads is the p53 and the p21 genes. The p53 and p21 genes are responsible for turning on apoptosis, or programmed cell death. But when these genes are mutated, they are no longer able to perform this function. Chemotherapy and radiation can actually cause these genes to mutate and no longer function properly. The third factor affecting the way that cancer grows and spreads is microtubules. Microtubules are the skeletal structure of cells. They make up the architecture of the cell, and there are chemotherapeutic drugs that are targeted to go after the skeletal structure of the cells, which affects its growth as well. The fourth factor affecting the way that cancer grows and spreads is the P-glycoprotein pump, which is a naturally occurring defense within our body. It's a pump within the cell that pushes chemicals out. As we increase chemotherapeutics within the body, this pump can become overly active and pump the chemotherapy out of the body, making it ineffective in treating the cancer. The fifth factor affecting the way that cancer grows and spreads is angiogenesis. Angiogenesis essentially is the way the tumor recruits a blood supply. It releases a chemical called VEGF that brings the blood supply to the tumor, and the tumor needs this blood supply if it wants to grow beyond 2 cubic millimeters in size. So as a method of treatment, we want to block angiogenesis, or the recruitment of new blood supply. The sixth factor affecting the way the cancer grows and spreads is the immune system and natural killer cells. The immune system is the first and last defense against cancer, and is an area that is normally not addressed. Natural killer cells are a part of the immune system and are very important because they can target tumors and cancer cells and kill them. We also know that a number of chemotherapeutic drugs need the immune system to be intact for the drugs to be effective. Over 10,000 times each day, our immune system goes about destroying cells that could become cancerous. The seventh factor affecting the way that cancer grows and spreads is inflammation and infection. We know that inflammation plays a major role in cancer. Chronic long-term inflammations, allergies, or chronic infections can weaken our immune system and create an environment for cancer cells to grow and spread. The eighth factor affecting the way that cancers grow and spread is the MYC oncogene. The MYC oncogene basically is a gene that can become easily mutated by chemical carcinogens from the food, air, and water that we take in. Mutated genes can cause cancers to occur. Mutation of these genes can also occur through bacterial and viral infections. We see this with the human papillomavirus that can lead to cervical cancer, Helicobacter pylobacterium that can lead to gastrointestinal cancer, or the hepatitis C virus that can lead to liver cancer. The ninth factor that affects the way cancer grows and spreads is exosomes. The cancer cells are intelligent, and tumors are intelligent, and they send out these little bombs called exosomes that target the natural killer cells of our immune system, and they downregulate them or try to make them ineffective because they know that the immune system is out to destroy them. The 10th factor that affects the way cancer grows and spreads is estrogen receptors alpha and beta. We know that estrogen plays a big role in cancer growth. They play a role in cancers that are estrogen sensitive. such as breast, ovarian, and uterine cancer. The estrogen receptors are throughout the body and are found in the colon, found in the prostate, found in the lungs, found in the bladder, found in arteries. They therefore can play a role in these cancers as well. Chemicals in the environment that mimic estrogen in our bodies can cause tumors to grow anywhere there are receptors. The 11th factor that affects the way that cancer grows and spreads is the milieu, or surrounding physical environment. Tumors need a certain environment for them to grow, and we'll use the analogy of fish. If fish are taken out of the water, they will die. They don't do well outside of that environment. Well, tumors also need a certain environment in the body to survive. They need an acidic environment that is low in oxygen. So by creating an alkaline, oxygen-rich environment, we can make it more difficult for cancer cells to grow and spread. A comprehensive cancer treatment program should target all 11 factors involved in cancer growth and spread. Invida's treatments can be used on their own or in combination with traditional chemotherapy and radiation. But unlike traditional chemotherapy and radiation, which target only 4 of the factors involved in cancer growth and spread, Invida's treatments target all 11 factors.
Welcome back. Before we went on the break, we were discussing cancer, and my guest is still Dr. Lars Ude Eze. All right, so we'll continue with the funding. Now, from my introduction, I read that 17% of African countries have not sufficiently funded cancer control programs now.
17 or 70?
17%.
Okay.
17% of African countries, they haven't sufficiently funded cancer, and that looks like it's part of the problem, with cancer prevention and treatment, as the case may be.
Right. Funding makes a lot of difference. Why I ask clarification whether it's 17 or 70 is if it's 17, then I would say African countries are doing well. But the reality is majority are not, funding it sufficiently. And funding has different parts. Recently, the government of Nigeria, the Federal Ministry of Health, launched the National Cancer Control Plan, 2018 to 2022, a 5-year strategic plan. And it's estimated that Nigeria will need to spend 97.2 billion naira-ish, to fund cancer control in the next 5 years.
That is just for control?
Yes, for control, not even treatment.
Not even treatment.
Yes. So, and WHO data suggests we have close to 100,000 new cases and over 90,000 deaths. In fact, in the world, Nigeria accounts for the highest number of cancer deaths. We don't account for the highest number of cases, but we account for the highest number of deaths. And what causes this death? 1, late diagnosis or late detection. So what causes late detection? There are various factors. Some are we as a people, some as the system itself. And in each of them, it has to do with money. For instance, the capacity to diagnose cancer deals with 1, human beings. You need to have human resources for health, people who are trained, who have the technical expertise to diagnose it, because it's not every, you have oncologists who are specialists. Cancer is a monster, so it's a very serious disease, and you have people who are dedicated to it and knowing so much about it, from diagnosis to treatment. And even among oncologists, you have pediatric oncologists that specialize in childhood cancer. You have gynae oncologists that specialize in cancer affecting female reproductive organs. You have radio oncologists that's about radio imaging, surgical oncologists, medical oncologists. From that area alone, from that area, you still have other subspecialties. And we need many of them. But for a country of, we'll say we are now 198 million or thereabouts, so we have, I don't think we have up to 200 oncologists. 200? I don't think we have up to that number. Maybe you're going to say 200,000. No. So, and that's part of the problem. So the only place you can diagnose cancer are mostly urban areas.
Yeah, of course.
That you can for sure, where you have, and you need pathologists, because it's the pathologist that will say this is cancer. When you take a tissue and you take it to a lab and they take a smell of it, prepare slides, look at the microscope.
Yes.
You need people who are trained to be able to differentiate normal cells and the abnormal. Even among the abnormal ones, not every abnormal one that is cancer. So there are things they need to. So if you have a place you don't have people with such expertise, they will not be able to diagnose cancer. And to have people with such expertise requires training. After medical school, before you go for that special training, when you are already a doctor. You know, as a doctor, you get, you know, training in every aspect, but that's more like general. So for you to be a specialist in that area is when you're already a doctor, you go in for it. So we don't have many people with such expertise. And even those that we have, how many of them are being engaged? So you need to employ, most times politicians build hospitals, they will call it state of the art, ultra-modern, the best in the world, all very fancy names. And the focus is on the aesthetics, fine buildings, flowers, nice pictures, and TV, cutting ribbon. When that is finished and the fanfare and all that, that is it. So they will just employ few persons to work there. And even when you employ people to work, you also need to train them.
Train them over and over again.
Yes. They treat malaria that appears so common. The treatment of severe malaria now is not the same one I was taught when I was in medical school.
Because everything is evolving.
It keeps changing. You know, the one that is responsive at some point may become non-responsive, and there are innovation, new things are coming up. So even when you engage those ones, you need to train them. You bring equipment. Cancer requires so much equipment from diagnosis to treatment. So those equipments, when you buy them, you must train people to be able to operate it. You must train people that will be able to maintain it. So what we have is, for instance, radiotherapy machine that's used to treat cancer as well. We have some of them bought over 10 years ago. And we didn't train people that could maintain them. So when they broke down, we started getting bills from persons out of the country. And the hospitals say, oh, we can't afford these bills. And the thing is there, Nigerians were leaving the country to go to neighboring African countries for radiotherapy. Some go to Kenya, some go to Ghana, some go outside Africa to seek that help. Very shameful. You know, so as we speak now, there are less than 5 functional radiotherapy machines in the country. The one at National Hospital, the one of Lut has packed up. They are trying to get a new one there. There is one in UCH that is somewhat functional. The one at UNCH broke down. They were working to fix it. Maybe now they would have fixed it. Then
this is to serve
200 million persons. 200
million people, and you're having cases of over 80,000 to 100,000 every day.
Absolutely. We are supposed to have at least one radiotherapy machine per 200,000 population.
That doesn't even look anything like what we have now.
So what we have in the entire country is what you find in one city in a developed setting. So right now you have, even for those that can, and why I'm explaining this thing is money. When we are talking about investing in health, allocating sufficient money to health. Health is expensive everywhere in the world. And countries have made deliberate, even developed countries where people have more money, they are not even allowing their people to pay out of pocket for health. They have a form of insurance that covers everyone. That no matter your level, you have health challenge, you'll be able to get treatment. So some countries, even African countries, if you have cancer, the government treats you free of charge. Or at least subsidizes some parts of the treatment. But in Nigeria, people are on their own. So, and that's the huge burden on individuals. And when, for those that even have the money, you want to do radiotherapy, in National Hospital, radiotherapy is 600,000 naira.
For you to go through?
Just a form of treatment. Radiotherapy alone is 600,000 naira.
Wow.
For some form of cancer, chemotherapy depends on the drug combination. You have some that will be for something thousand per session. You have even a breast cancer drug that is a dose is over 200,000. It used to be more than 500,000 per dose, and you take so every 3 weeks you take many doses of that. So
it's not just having the cancer itself or trying to treat the cancer. The cost of treating cancer is,
and that's what's killing Nigerians. Yes. What's killing Nigerians is that even for those that identify it on time, when they start, some will say, not my portion, they will run away. When it gets serious, spread everywhere, they will come back. Some will be willing to say, okay, yeah, let's move on. And they say, do this test. Even from diagnosis, they run out of money. You know, so even before you could fully diagnose what it is, the thing is already maybe in the process of even diagnosis or treatment, strike. So all this strike that is go about, you know, is also very injurious. Because for someone who is on treatment and the doctors or nurses or any of the health workers go on strike, you know, the cancer cells don't understand. They keep spreading. And when they go on strike, they will not be able to, they are even struggling, begging for money here and there to afford the treatment in the government hospital. And strike begins. If they must continue the treatment, they need to go to a private hospital.
So presently in Nigeria, there is absolutely no organization that can support people that,
there is.
Okay, suffer cancer.
There are many organizations, but it's not sufficient. My organization, the Pink Oak Cancer Trust, is established primarily to mobilize funds from well-meaning individuals like you and every other person, and also corporate organizations as part of their corporate social responsibility. Because, you know, it's a way of taking action. We've been saying, advocating, government putting more money, do this, do that, but it doesn't appear to be a priority. A number of NGOs have been helping out, but they are largely concentrated in the cities, you know, which is also the hospitals that can diagnose or treat cancer are also largely in the cities. So the NGOs, they do help to sensitize people, awareness, do screening in some cases. And you have NGOs that support people with funds. So they talk to them, get their picture, put it out there on social media or TV or radio, and good-spirited Nigerians donate. But, you know, those money come in trickles, small, and you get some money now, you do this, you start waiting for money again. Before you know it, cancer that is at stage 2, we move to stage 3. And the more time is wasted, the worse the prognosis. So the likely outcome gets worse, the more time, you know, so we don't quite have, some cancers can spread very fast. Somebody that is so healthy now and just identify something, in the next 2 months, the person is like a ghost. You know, so there are some cancers like that, some that are more gradual, like prostate cancer, you know, takes a longer time to come up. So Pink Oaks Cancer Trust is trying to mobilize these resources, not on patient-by-patient basis, but we've estimated that, okay, we want to help a number of patients. For instance, in 2018, we've said we need 200 million naira. A study has been done to know the average cost of treating a cancer patient, say breast cancer, for instance, which is the most common, and realize that we need like average of 3.2 million naira
per person to
to treat one. Average. Some could be more than 10 million. Some could be about 1 million or 2, you know, depending on the stage and, you know, a number of other factors. So we said, okay, we want to treat 50 patients this year, but 50 is like a drop in the ocean.
You're looking at almost 250 or 100 and something, you know, patients coming on every day.
Yes, and in April, we launched Donate to Beat Cancer campaign.
Yes, that's the shirt you have on.
Yes, that's what I have on.
So that they will get it on the camera. People need to donate to beat cancer because it's very important. The funding is almost the main solution.
Absolutely, you know, so that's an aspect of it. And Donate to Beat Cancer, we just checked between April and May from donations from well-meaning Nigerians. We've got above 1 million naira. The least donor donated 100 naira. The highest donor donated 200,000. You know, so it shows all those money. If you have 1 million Nigerians donate 100 naira, that's 100 million naira. Yes. So, and that's what we're targeting. We have the population. So we don't wait till, oh, you can donate 200,000 or 1 million.
You have,
just 1,000 you put it out there. If you have 1,000 Nigerians donate 1,000 naira each, that's 1 million naira. And with 1 million naira, we can sponsor a patient on radiotherapy at National Hospital. And perhaps pay for the patient's surgery, the patient needs surgery. And that could make a lot of difference whether the patient lives or doesn't live. So that's what we are trying to do. But Nigeria is so big, this is not enough. This is just a short to medium term solution.
But it's starting somewhere, because at least somebody like you is taking the initiative to see, you know, this I think maybe with time we'll look for, because I'm sure people will call in to say, okay, let's, you know, how do
we are doing this, but we want Nigerians to hold the government more accountable. The truth is, this is not a case of say a government can't do everything, right? Government can do everything when it comes to this, and government can do most things when it comes to this. And when we're talking of government, it also involves us with the followers, but we need government to take that leadership. If we have universal health coverage, health insurance, every car, they will ask you to get insurance for car. So why not for the life of a human being?
Yes.
You know, so a child from when he's born to when the person grows old and dies should be covered by insurance. And these things we consider small money. If each of us, those that are working, contribute certain amount into the insurance scheme, and those that are less privileged, for children under 5 years, for elderly people, retired persons, you know, and for certain categories, maybe some people living with disability, and other, government can pay for those ones, right? Like premium for them. Yes, then those that are working also pays. We have a pool of funds where no matter the health condition, whether it's cancer, kidney failure, malaria, whatever, no matter how simple or complicated it is, you can, and if you have to pay at all, it doesn't mean that you get it free. Universal health coverage means that everybody can afford healthcare without financial difficulty. It means that you don't have to borrow money to treat yourself. It means that you don't have to choose between paying your child's school fees and you know, treating. You don't need to sell your property. So no matter your income level, if you are to pay, it will be an amount you can afford to pay. There are some services you may get free, and there are some you may have to pay some money. But it will be an amount you can afford, not something you cannot afford.
No. So how do we start holding our government responsible? Because is it by, you know, joining in campaigns, or how do we do? Because it's worrying. It's
worrisome. First of all, we need to be informed. We need right now, yes, with the internet, people should learn about reasonable things on the internet, and not whether someone is invited and the person refused to come or not. That's important for democracy. But we should also pay attention to the real issues. So you inform yourself, you ask questions, you listen to shows like this, and you get inspired and inform yourself. And you now begin to ask the right questions. This is an election year. This is the period to ask questions. Those persons that is coming, instead of asking for food or asking for money, ask the right questions. Politicians are amassing so much wealth because what majority of the citizens ask them about is money to dash them things. And they want to get as much as possible to share. When we begin to ask them more questions about why is it that we have about 5 functional radiotherapy machines in Nigeria, you know, why is it that government is putting just 4 or 5% of its annual budget, federal government in this case, to health, when it is signed in 2001 Abuja declaration that at least 15% should go to health. And even among the ones that go to health, that they put in the budget, not everything is released. And even among the ones that are released, most of them are released in the 3rd or the last quarter. They are released late, when you cannot even use it. You know, so, and even what is budgeted for is mostly buy computer, buy car, buy this, go attend conference, you know, and not on things that have direct effect on the quality of healthcare service. And when I talk about government, it's not just the federal, local governments, what are they doing? Like screening, community awareness, health education are the job of local government. So are they sensitizing the people about these conditions? Who health educators that are supposed to work in the local government? You go to health centers, you have 1 staff or highest 2 in most parts of the country. It's mainly in urban places like Abuja, in the cities, you see more persons. You go, you don't find people, and you expect that one staff to be at work every time.
Every day, and the person can
He
walk
or
down
she
and
will
make
go to
mistake as
farm.
well.
He or she will go to farm, he will do school runs, you know, he will attend weddings and other things. And when the person is going for those things, there's nobody in the health facility. So you're supposed to, for a fully functional primary health care, you need over 20 staff. Some will be cleaners, some will be pharmacy technician, dental person, mental health person, you know, and you need state and local government to pay attention to that. So in cancer care, please, you know, because we are talking cancer today, but it has, you know, every other health condition. If you pick kidney disease now, it's a different ball game. If you pick maternal health, pregnancy-related issues, you know, so it affects everything. We need more funding for health. And we need to demand it as citizens. If we don't demand it, this, you know, there are so many things competing for needs. They want to build bridges, flyovers, but even where you don't have cars.
Well, who will go on the flyover?
Even when you don't have cars to ride over the flyover, they want to build it there because you take it in a picture and there's lights and everything is looking beautiful and we are clapping. But, you know, flyover is good, especially where you have traffic. But there are places you don't need it. Why not invest that in health of the people? Because investment in health is actually is an investment. The mindset of our people and politicians is like health is charity. Free medical care, free health screening. Health is not free. Anything you're getting free, someone is paying for it. You know, so it's not charity. It's something that now prevention is better than cure. So if we have insurance, people can go annual screening, check-up. You don't wait until it comes. Things can be picked up on time. You need treatment, you have money to treat it. So, but for now, please donate to beat cancer.
Yes, that's a very good donate to beat cancer. I think, well, I'll discuss with the producers and see how to put it up in the advert if you want to.
Yes, and we are ready to partner with you guys, your station, to encourage entirely charity. We want to raise so much money to the level that at least 80 to 90% of the money we raise goes to treating patients, and maybe 10 to 15 we go to operations, you know, paying staff and all those things.
All right. Okay, thank you very much. A lot, because we got to the end of the program, a lot has been said, and I see that passion with funding, and we really pray that God will help and send people to help, and as many people that are watching should, you know, donate the little, 100 naira from. There's 10 million people, isn't it?
We have offering box, pink coke, offering box. We can bring it to the churches, to your branch, and you do collections. You know, all those things are really important. Yes,
people should invest. You might don't know who you're helping. You know, it always comes around. Anyway, thank you very much, Dr. Lars, for coming on the program.
Thank you, Angela.
We'll call you back again for other sessions.
No problem, it's my pleasure.
You come in for other sessions to discuss. All right, that's all we can take on the program today on cancer. And I want to believe you have learned a lot on cancer in general, but at the same time it's important for us to know that we can also do something to help people that are suffering from cancer by donating to Pink Trust, or you can even call us and, you know, find information, out how you can help, you know, in beating this cancer. I am Angela Wenze. Until I come your way again, God bless you. Bye-bye.